Do you want to give just an introduction about what Agent Orange is?
So when we talk about Agent Orange, it's kind of a catch-all term. Agent Orange is one specific chemical composition that was used for an herbicide that was used in Vietnam to defoliate trees, basically kind of destroy the jungle area, destroy the coverage so, people could see what's going on underneath. There was Agent Blue, Agent White, Agent Orange. I mean, it sounds like Reservoir Dogs. They had basically every color. But Agent Orange was the most commonly used. Something that, the military didn't realize as we're using it as an herbicide. Very poisonous to plants. It's also very poisonous to humans and, other life forms.
Right.
That a lot of veterans who were in Vietnam and were exposed to these types of herbicides came home and eventually developed a lot of different conditions that have later been found to be related to exposure to these chemicals.
Yeah. Over the years, after Vietnam veterans were coming home and being treated for the same conditions, the VA, they all began doing studies. I won't try to quote exactly who. And they decided that it was time to create these presumptive conditions. It means that the VA is conceding something. Agent Orange case, they're conceding exposure if you meet certain eligibility, and they're also conceding the connection. So in a normal service connection claim, we have to prove current diagnosis, in-service injury or event, and then the link or the nexus to connect the two. Mm-hmm. And so with the Agent Orange presumption, basically you're given the presumption of exposure, and then as long as it's one of the conditions that they found to be presumptive, you're also given the presumption of the connection between the condition and the exposure that the veteran had.
Mm-hmm. So there's many different conditions on that list. I don't think I can name them all. Some very common ones that we see all the time: diabetes type 2, heart disease, Parkinson's, that's a big one. Also, they've recently added hypertension,
right,
which was a really big one.
We see a lot of bladder cancer, mm-hmm. prostate cancer, mm-hmm. and then recently they had added the hypothyroidism. Mm-hmm. There are a number of different conditions that you definitely want to check out our website or the VA's website if you think that you may have any of those.